the most merciful. إن الله وملائكته يصلون على النبي يا أيها الذين آمنوا صلوا عليه وسلموا تسليما. 2 weeks ago we discussed, we started the discussion regarding common dental problems. We discussed the importance of preventing the initiation and progression of dental problems. And we said that these dental problems can be prevented, and it's having the right knowledge which comes from our parents, and then from going to school and having the right advice from our dentist is really, really important. And I also mentioned about the link between oral dental problems and also our general health, and that often people who have systemic problems like diabetes or heart disease, they also sometimes suffer from they're more likely to have dental problems as well, like bad oral hygiene. We don't want to go into too much more detail regarding that today. I don't want to go into so much more detail regarding that today, but inshallah in future sessions we can, if needed. Some of the viewers and people who are listening, they had some questions, so I was hoping I could answer those questions today, inshallah. So one of the questions one of our friends had was, what are the homemade treatments or remedies we can use, and where can we get help in case of having a dental problem in the middle of the night or during the weekend or on public holidays, bank holidays. So the first part of the question is, what are the homemade treatment remedies we can use? So it really depends on what the problem is. So if the problem, so the question, we need to find out what the problem is, what the dental problem is. So for example, if the problem is a broken tooth, or a filling has fallen out, has come out, then you can use temporary filling material, which you can purchase from a chemist or a pharmacy local to you, or from a supermarket, and you can read the instructions before applying the temporary filling onto the tooth which has broken, or the filling has come out. So there are homemade there are some like ways we can sort of do a temporary measure at home, but it will depend on what the problem is. Unfortunately, during the COVID-19 pandemic, majority of dental practices were closed. The chief dental officer of England, Sarah Hurley, she basically forced all dental practices, the majority of dental practices in England and in the UK, to close, so the people had no access to their dentist. So this went on for about 3 months, 3 or 4 months, 3 months at least. Dental practices were closed, so alhamdulillah, dental practices have reopened now. So in the first instance, if you have a dental problem, you should contact your dentist. Your dentist, if it's out of hours, your dentist, you can leave a message with them, or you can write an email to them, and they should get back to you within a reasonable time frame. If on the other hand your dentist is not getting back to you in a reasonable time frame, you can call the NHS 111, and they can provide dental advice over the phone for your problem. So that's what I would recommend. The other question one of our friends had was which toothpaste is I recommended adults to use, and the toothpaste is called Durafat 5000, and it's by Colgate. So if you're 16 years and over, you can use this toothpaste. If you're over the age of 10 and not 16, you can use the Durafat 2800. So if you're over 16, you can use Durafat 5000, and if provided you're pregnant, if it's a pregnant lady, then she should not use this toothpaste. So it's only for people who are not pregnant, and for adults over the age of 16. Durafat 5000, it's called. It's by Colgate. And if you're under 16 and over 10 years old, you can use Durafat 2800. And again, these are prescription toothpastes, which you have to ask your dentist for this toothpaste, or you can ask your GP for this tooth to give you a prescription, or actually to sell you the toothpaste in their practice. I can send a photo of this toothpaste as well, if anybody wants to see what it looks like. So that was a toothpaste. If you want to use that, that's the best toothpaste to use. The benefits of the toothpaste is it's prevents dental caries developing, and it has a much higher concentration of fluoride, which is preventative. It prevents dental caries. So going back to the question about if you have a dental problem, you should first contact your dentist, and they should be able to advise you. If you can't get hold of your dentist, then you should call the NHS 111. If the dental problem you have is like life-threatening, like it's a very serious problem, it's life-threatening. For example, you're finding it difficult to breathe. You should, of course, go to your local accident and emergency hospital, and they will help you there. I hope that's answered that question. Also, there are some dental practices which are open 7 days a week, and they run a dental emergency service, and they're open 7 days a week, and sometimes even they answer calls out of hours, like late at night or in the morning, early in the morning. So you can also call these practices if you want. And there are some open in London who provide these services. So I think there was one other question. One of our brothers or sisters had a question about root canal treatment. I'm not sure if they wanted to know what is root canal treatment, or when do you need root canal treatment. So I'll explain both really. So root canal treatment is when a tooth has an infection, and the tooth is causing, often this causes pain. Sometimes the tooth is not the infection is not causing pain, but most of the time it does. And the infection can be caused by it could be caused by a cavity in the tooth which has reached the nerve. it can be caused by, which is the most common cause of the tooth becoming infected, or it could be due to trauma to the tooth. For example, if the front tooth has been traumatized by an accident or a sports injury, that can cause the tooth to become infected. Also, a gum infection can also lead to a tooth infection as well, and that can lead to the tooth needing root canal treatment. So root canal treatment is necessary when the tooth has become infected, and often that can lead to pain and swelling and sometimes you can get a facial swelling or an abscess on the gum. And the root canal treatment is provided basically to preserve the tooth rather than remove the tooth. So the options the dentist will give you is to save the tooth with root canal treatment or to remove and extract the tooth. So those are the two options when the tooth has become infected. And usually it's your choice whether or not you want to keep the tooth or not. So if you decide to keep your tooth, then the treatment would be needed. The treatment that would be needed would be root canal treatment, and it's normally performed in 2 stages, 2 visits at the dentist, but it can be performed in one. It can be performed in one visit as well, and it's a slightly longer treatment. So you'll be at the dentist for probably longer than you want. So it's usually 2 or 3 hours of treatment per tooth, 2 hours usually, and when you visit the dentist, they will give you local anesthetic to numb the tooth so that you don't feel any pain, any discomfort, any sensations, and they start the root canal treatment, which involves removing the infected nerve from inside the tooth and cleaning the infection out of the inside of your tooth, and cleaning and usually you have like a small dam. It's called rubber dam, placed over your mouth and exposing your tooth, and the dentist will be cleaning inside the tooth with bleach and other irrigants, and that's part of the procedure. So once your doctor dentist has completed the root canal, they need to fill the canals, and that's why it's called a root canal filling. And they then take an X-ray, and then they place a crown usually on the tooth to give the tooth protection from fracture. Other times when you need a root canal would be maybe if you have a crack in the tooth and the crack is quite deep and has reached the nerve, and this can lead to bacteria infecting the inside of the tooth and causing an infection. Also, if you have a very big or deep filling in your tooth, sometimes this leads to the nerve becoming infected and dead, and then your dentist and then you develop pain, maybe slight pain or pain when you're eating or chewing or just biting down, and that can be an indication that there's an infection, and which results in pain usually. So the causes can be tooth decay, gum problems, tooth fracture, trauma, any sort of damage, any sort of it can be due to sort of dentistry that you've had in the past, like if you've had a crown on your tooth. This can be a crown is in some ways an attack to the tooth, and that can result in the nerve becoming infected and the tooth needing a root canal. So a deep filling or fractured tooth. These are indications for a root canal. And sometimes the tooth just needs a root canal because we don't know why. It's called iatrogenic reason. We don't know really why it's become infected. So root canal treatments are quite a big area in dentistry. Probably some of us have had a root canal in our lifetime. It's not a very pleasant treatment to have, but it does mean your tooth is saved rather than extracted, which is not desirable, really. The general dentist can perform root canal treatment, and also it can be performed by a specialist dentist called an endodontist. So they are dentists who have specialized in root canal treatments, and they've probably spent an extra 3 or 4 years of training and studying and practicing this treatment. And so they also they are specialist dentists for this treatment. Any tooth in the mouth potentially may need a root canal treatment if it's become infected. So it can be on your front tooth, it can be on your middle tooth or your back tooth, and the further back you go, the procedure becomes more longer and potentially more complicated and longer and more expensive. So that's why it's important to clean all of your teeth, especially the back teeth, every day with Durafat 5000 or 2800 toothpaste, and floss daily and clean it between your teeth every day, twice a day at least. And also your diet is very important, because it's our diet which results in which can influence our dental health. For example, as you know, if you have a high sugary diet or acidic diet, it's detrimental to your teeth and your gums and your dental health. I think I've covered the questions that were given, but if I've missed any questions, please ask me again now.